Dumelang Sanbonani, my name is Berlina Lerutoane from the Sports Arts and Culture sector in the Northwest. Welcome to Lekgotla 2025 podcast, where we dive deep into the conversation that matter. This episode is all about the highly anticipated Sanac Civil Society Forum Lekgotla 2025, a crucial gathering set to take place from March 18th to the 20th at Emperor's Palace in Ekurhuleni, Gauteng. This event is a space where collaboration meets action, where strategies are shaped, and where the fight for health equity takes center stage. So stick with us. We are going to unpack all the matters that are crucial. Powerful discussions are going to be had, and groundbreaking interventions from the Sanac Civil Society Forum, Lekgotla 2025. With that said, let's welcome our first guest, Grias Kuman, to the show. Thank you for joining us in this platform.
Thank you for having me.
Thank you. Kindly please introduce yourself to us and the nature of your work.
Thank you so much. My name is Grias Kuman. I am currently developing the Sanac CSF strategy that is spanning from 2024 to 2030, but my work with civil society goes way back. We started this journey in 2020, where I started working with different civil society sectors, and in this time, we've been able to do some great work across sectors and across provinces.
Yeah. Can you please give us an overview of what Civil Society Forum Lekgotla is all about and its significant in the fight against HIV, TB, and STI?
So the Civil Society Forum Lekgotla only happens every few years. Our first Lekgotla was in 2019. We had a follow-up Lekgotla in 2022, and so this is our third in 2025. It is, in effect, a governance conference of the Sanac CSF, and it brings together the leadership structures from district, province, and national. As you know, the Civil Society Forum is represented by 18 sectors. So if you take that and you cascade, we've got 52 districts. So you'll have 52 times 18, 9 times 18. And of course, then our different leadership levels that are represented at national, it spans the breadth of rural and urban South Africa. It ensures that all of the leaders, decision makers, influencers in civil society are gathered in one place and develop common agendas, develop key strategies, and decide on the most important strategic direction that will guide the Sanac CSF for the ensuing period. So I began by talking a little bit about the CSF strategy. One of the key outputs that we will have here is looking at how we cement the governance framework and how it is that we also endorse the implementation strategies that should cascade from district, province, national.
Yeah, so you touched based on the next question, but can you give us a highlight of what are the objectives of this year's Lekgotla and what are the outcomes that are anticipated for this year's Lekgotla?
So in 2025, the Sanac CSF has matured to such an extent that a large focus has got to do with ensuring that our governance frameworks are standardized in line with the resolution that we had for the standardization framework. So it will be to ensure that all of our leadership layers are effectively sensitized to this. One of the key activities that we also undertook actually coming into the Lekgotla was an engagement with all of the provincial sector leaders. And in that we looked at how it is that we would align our provincial priorities with national sector activities. So one of the key outcomes and objectives that we want to therefore see is proper alignment across CSF structures, concretization of resource mobilization and sustainability strategies.
Thank you. I feel like you're answering me before the questions. It's like you know the questions and you don't. But the next question was going to be, with various stakeholders coming together, how does this event foster collaboration between civil society, government, and private sector, as well as health sector?
One of the essential things that we've been looking at and have been reflecting on, not only in the last period leading up to the Lekgotla, but probably since the last Lekgotla, was to say, how do we ensure accountability of duty bearers? When we look at the gains that we've made in the HIV response, these are gains that were driven by civil society. The reflections that we've had in the ensuing period is to identify really the gaps. Who are the key partners that we need to turn the tide? So what we do in the space is we bring together different ministers to come and talk to us directly. We will engage DGs. We will also set out our expectation in terms of what business needs to do. We've seen there's a big interest, but we really want to ensure that at the end of the day, now more than ever, they put the money where the country's needs are.
Absolutely, we really need government to come within and collaborate with civil society, especially with the heat that we got from Trump. It's really going to be a strain for the country. And if we are saying that we want to end the HIV pandemic by 2030, we'll need to work together as a country. So what are some of the biggest challenges facing the civil society in the strengthening of HIV, TB, and STI in South Africa?
What we have seen within the Sanac Civil Society Forum internally that we are seeking to address is poor coordination of various civil society structures. We are seeking to respond to this through the standardization framework and ensuring that there's effective implementation. And then there's the massive resource gap. We need to ensure that government effectively resources civil society to do the work. It is well known and well established that civil society actually does work at a fraction of the cost of what government does. Civil society are able to quickly develop responses in order to meet community challenges, tailor the best solutions. So when we talk about what are the major challenges that we are facing as civil society, it is resourcing so that we can be more effective in the work.
So can you please give us a high level of some of the successes that you have encountered since you are working with civil society?
Certainly, I would say there are a few. If we were to look at a standout one with regards to ensuring that resources go to the right places, it would definitely be the way that we've engaged with the Global Fund process. The Global Fund provides massive grants to the country in terms of our HIV response. The last grant value was around 8 billion rand over 3 years.
That's a lot.
That is a lot. What Sanac Civil Society Forum managed to do is actually bring the voices of communities directly into the boardroom tables to determine what the key activities should be, where they should be implemented, and having a feasible discussion around how we also ensure that our civil society structures are strengthened. Accountability is critical to us. And so as civil society, that accountability is there. Accountability of duty bearers is also something that we really use different platforms to extend.
Thank you so much. One thing that is interesting is that we engage with different people and people are speaking with the same voice. Dr. Kulu spoke about we need to have funding for the healthcare workers that are working in the ground. And you are speaking on that, you are touching on resources. So basically we need government to come to the party and hear from the people who are implementing on the ground what are the challenges and how can they assist, what can they give to the community so that we fight this battle together. But thank you so much for that brief conversation and see you next time.
Absolutely. Thank you so much.
Thank you. Welcome back. My name is Berlina Lerutoane from the Sports Arts and Culture sector in the Northwest. Welcome to our listeners. now we have our second guest, our special guest, the CEO of Sanac, Dr. Xulu. Today we are attending the CSF Lekgotla at the Emperor's Palace, and this event will take place for the next 3 days. To spice things up, tomorrow we'll be hosting the Red Ribbon Human Rights Awards. So be on the lookout, as we will be live on our social media platforms, on Show Me Your Number Online Radio and the Sanac pages on our social medias. Right now, as I said, we have our guest, Dr. Xulu. We welcome you to the Lekgotla 2025 podcast. Can you kindly introduce yourself, Kancani, and give us just a high level of the work that you do?
Thank you so much, Berlina. Good afternoon, good morning, good evening. My name is Dr. Lekgotla. I am the Chief Executive Officer of the South African National AIDS Council. I also serve as the chairperson of the South African Global Fund Country Coordinating Mechanism. Sanac is the highest decision-making body in terms of HIV, TB, and STI policy in the country. And we essentially coordinate government, so all government departments, civil society, the private sector, our donors, and labor to make sure that we are all pulling in one direction as defined in the National Strategic Plan for HIV, TB, and STIs for 2023 to 2028.
Absolutely. So what are the biggest challenges that are faced by the country in the response of TB and HIV and STI?
At the moment, we are very behind in terms of the targets for UNAIDS. So the United Nations sets targets for countries. These targets are called the 95-95-95 targets. And we are supposed to meet these targets by the end of December 2025. For the second 95, South Africa is sitting at 79%. When you define those 95-95-95, the first 95 means 95% of people living with HIV must test and know their status. The second 95 means they must be on treatment, 95%. And the third one says 95% of those must be virally suppressed. So we have a problem with certain populations that are not on treatment. So we have launched a campaign looking for 1.1 million people, men in particular. We're looking for children, we're looking for young people, and we're looking for key and vulnerable populations. So that is one of the biggest problems that we are facing, that we are not meeting our targets for UNAIDS. We are also not meeting our targets for the NSP, our targets for the NDP 2030, and our targets for the Sustainable Development Goals.
Thank you so much for touching on that, because when we speak about the 95-95, we just talk like everybody understand what we are talking about. Thank you for elaborating on that aspect. How does the lack of resources and health infrastructure impact the response of HIV, especially in the disadvantaged areas and the rural areas? How does the lack of resources impact those places?
Berlina, you are asking me this question at quite a pivotal moment in terms of the shifting geopolitics around healthcare financing. We've just had the US government issue executive orders, and these executive orders have impacted the delivery of community systems in our country. And we all know that the healthcare infrastructure in South Africa is divided. There's the public health sector and the private health sector. The private health sector sees less patients, but sees the ones that are more affluent. And the public health sector sees most people that don't have much. And the private health sector is more expensive, and the public health sector is essentially free to everybody that accesses it. So we have the community sector in between, trying to be a safety net to catch people that can't access public or private health care. And this is where donor money was going. Because people that are belonging to the LGBTQI communities can't access care in public or private, they primarily go to community-based sectors. And with the US executive orders, diversity, equity, and inclusion has been completely excluded, and therefore the ability to get health at community level is no longer possible. And that is a challenge that we are facing, that we are not able to socially contract community-based organizations to keep on giving services to key and vulnerable people at community level. And that is a challenge that the government needs to help us to deal with.
One thing about Dr. Kulu, she understands the work that we do. And, you spoke about having a full funding for healthcare workers that are working on the ground. And you're still touching on that as you're speaking about rural areas. How important it is for government to come into the party as well as the private sector to ensure that people who are working on the ground are fully funded, because they know the challenges that are encountered in the ground. So how important it is for them to come and fund the work that we do.
There is no doubt that even for the government to get national health insurance right, the role of communities is important, because if national health insurance is going to be rendered to communities, communities understand the problems that they face. When they understand the problems that they face, they also understand the solutions to those problems. So you need to engage communities as meaningful and as equal and strategic partners to be able to render solutions that make sense for them. And it's the same for the private sector. Let's just take a mining company, for instance. Mining companies have got the responsible for the peri-mining communities in order to render services not only for the employees within the mine, but for the people that live around the mine, so that they're able to get access to services that may result from some of the services or some of the issues that emanate from the services that the mine itself is giving. So it's important for the private sector to understand the communities that it's dealing with in order for it to be responsive to the needs of those particular communities. And it's the same for the government. We elect the government as the people so that the government can respond to our needs. So communities need to be understood in that sense.
Absolutely. Communities need to lead in the response in their communities, whether it's health, whether it's poverty, and etc. So it is important that we take the people in the field or in communities seriously, and we can't make decisions when we are sitting in parliament because we don't know exactly how people are impacted in the field. What can an ordinary citizen in South Africa do to contribute in the advocacy of better health and better facilities?
An ordinary South African, I would say, Berlina, they need to keep themselves informed. You need to empower yourself. Absolutely. Make sure that you get access to Show Me Your Number, listen to radio, and read articles. Make sure that when there are calls for community participation, you take part in your immediate community. Take interest in your community policing forums. Make sure that you keep yourself aware of where the country is going, so that you are not just a beneficiary of services, but you are somebody that says, actually, in my community, these are the problems and these are the solutions that we would want to see. And beyond that, we have now started implementing something called CLM, or community-led monitoring, where communities are leading. So we are saying, let communities lead. So as policymakers, lead us.
Absolutely.
Lead us as a normal citizen, lead us and tell us what is it that you need, so that when we craft the policies, they are responsive to your particular needs.
Absolutely. People need to be engaged in these topics. I think people in the communities are not really into the work that we do. When we talk about HIV, TB, and STIs, like you are stressing them out. I had a lot of conversations with a lot of people after the Donald Trump thingy, and people did not realize how impactful that thing is going to shut us as a country. They did not realize it was like, it's because you guys are working there, so you are going to benefit. But I'm just like, no, do you understand that they contribute to the health system, they contribute the medication, so it is going to be impactful in a bad way for us as a country. So how do we then come together as a country, as people in the ground, to say, let us advocate for better health systems, better access to services, and, advocacy must be the key
Absolutely.
moving forward from now, because we know our country.
Absolutely.
But thank you so much for joining us today. You are such an intellectual woman. We could go on and on, but due to time,
I do want to just make one last point on the mention of the US executive orders. I think South Africa is fortunate in that 76% of the HIV response is funded by government.
Yeah.
So when you look at it, 2% is the private sector and 74% is from the fiscus. And what you find from donors is 17% from the Americans and another 7% from the Global Fund. But what that 17% and the 7% does is it funds communities. And that is where it's important that when we look at National Treasury and we discuss ways of innovative financing and sustainable financing, we put communities at the center and we make sure that communities are funded to lead effective community responses.
Absolutely. Thank you very much
Thank
for
you.
that. And it was really working out, because this funding could reach other places that we cannot reach as a country. There are places in the provinces that are abandoned, and we know in Northwest, in KZN, there are those places where people cannot reach because they are far. So we really need to come together as a country and ensure that by 2030 we reach an HIV-free generation. That was Dr. Xulu. Thank you very much for joining us.
Thank you so much.